So, you want to be a nurse, or you don't, but you just want to know the different types of nurses? Well, nurses can work in a variety of specialties in the healthcare setting, but the term nurse can be under an umbrella of educational levels, including CNA, LPN, RN, and APRN. Let's first consider the CNA, or Certified Nurses Assistant. States may vary on educational requirements, but in Missouri, it's typically a program requiring 175 hours of class and clinical instruction in a 12-week time frame. To gain licensure, you must pass a 75-question state board exam. In hospitals, educational requirements may be different, like shadowing preceded by hands-on training with titles such as patient care tech or clinical associate. CNA's duties typically include ADLs like feeding, ambulating, and cleaning patient, obtaining vital signs and blood sugars, emptying catheters, and even emptying JP drains and removing IVs. CNA salaries typically range from $25,000 to $30,000 a year, but this could be different based on bonuses and contracts. Next under our umbrella is the LPN, or Licensed Practical Nurse. To become an LPN, you go through a 12 to 18-month educational program and also have to pass the NCLEX PN, or National Council Licensure Examination, Practical Nurse. LPNs can do just about anything RNs can do and can make $40,000 to $45,000 a year. Because of the similarities, it's easy to list the things that LPNs cannot do compared to RNs, which includes administering intravenous medication and fluids such as TPN, blood products, and chemotherapy medication, initiating PCA pumps, and obtaining blood samples. The third term under our umbrella is the RN, or registered nurse. There are two types of RNs. The first is an associate's level, which typically takes 2 years to complete. The next is bachelor's level, which takes about 4. Once either of these educational levels are completed, it qualifies you to take the NCLEX RN exam. Passing this test licenses you as a registered nurse. Some job duties of RNs include observe and assess patients, educate patient and family, administer medication, prepare for tests and procedures, and coordinate patient overall care. Registered nurses can make about $60,000 to $65,000 a year. Lastly, under our umbrella is the APRN, or Advanced Practice Registered Nurse. To become an APRN, it takes 2 to 3 years post-RN education, so typically 6 to 8 years in total depending on the specialty. State exam will also depend on specialty. APRN specialties can include geriatric, neonatal, anesthesia, midwife, and women's health. Nurse practitioners can diagnose and treat patients, prescribe medication, order labs, diagnostic, or preventative tests. Most APRNs are under the supervision of a physician and frequently collaborate and consult with them. An advanced practice registered nurse can make $95,000 to $100,000 a year. Hopefully after watching this, you are able to get a better understanding of the different types of nurses and what they do. If you learned something today, give this video a like, and if you want to see more, go ahead and subscribe.